Assalamu alaikum. Today I'm going to read a clinical case number 16, that is a 2-year-old girl with an irregular pupil and white reflex. Here is an overview of the case. This is the case of a 2-year-old Asian girl who presented with an abnormal left pupil shape and a white reflex known as leukocoria, noted during a routine examination. The rest of her physical examination was unremarkable and there was no family history of ocular or systemic disease. She had a normal pregnancy and a birth history and had recently arrived in the UK. Investigation, including blood tests and imaging, were normal. An abnormal shaped pupil indicates a congenital defect of the iris, which suggests an iris coloboma. Coloboma is a key feature caused by incomplete closure of the embryonic fissure during ocular development. This fissure normally closes between the 5th and 7th weeks of gestation, and its failure results in a coloboma. The word coloboma comes from the Greek word meaning curtailed or incomplete, describes a missing piece of tissue in one or more parts of the eye. The condition can range from mild to severe depending on which structure of the eye are affected. It can involve multiple structures and symptoms depend on where the defect occurs. Iris coloboma affects the colored part of the eye, the iris. The pupil appears keyhole shaped or irregular instead of being round. This may be purely cosmetic with no effect on vision if other parts of the eye are normal. Here, cosmetic contact lenses can make the pupil appear round, and no treatment is needed here if vision is not affected. Another type of coloboma is chorioretinal coloboma. This happens at the back of the eye, affecting the retina and the choroid plexus, the blood vessel layers. It can cause vision problems or a white reflex in photos. Optic nerve coloboma affects the optic nerve which connects the eye to the brain. It can cause blind spots or blurring vision depending on how severe it is. Next type is lens coloboma. This is a notch or defect in the lens of the eye. It can make vision blurry or distorted. Another type is eyelid coloboma. This is a gap in the eyelid. It does not affect the vision directly but can expose the eye and cause dryness or irritation. Some colobomas are part of the larger syndromes like CHARGE syndrome, which affect multiple parts of the body. The impact on vision depends on which part of eye is involved and how severe the coloboma is. If coloboma affects vision, the first priority is to correct it by giving glasses or contact lenses to fix common vision problems like nearsightedness, farsightedness, or astigmatism. Another way is amblyopia treatment, that is lazy eye. If one eye is weaker, we cover the stronger eye with a patch for a few hours a day. This encourages the weaker eye to work harder and develop better vision. Coloboma can lead to complications over time, so regular checkup with an eye specialist are essential. Checking for retinal detachment and monitoring for glaucoma. Kids with coloboma often have light sensitivity. Sunglasses can help to reduce discomfort and protect the eyes. Surgery is not always necessary, but in certain cases, it might help for eyelid coloboma and for cataract or retinal detachment. The child's prognosis depends on how much of the eye is involved. If the central retina or optic nerve is not affected, the child can have good vision with proper management. Regular follow-ups with an eye doctor are key to catch any changes early. The goal is to ensure the child can see as well as possible and live a normal life while addressing any cosmetic or functional concerns. With the right care, many kids with coloboma do very well. Let's come to the question. Which of the following is the most likely diagnosis? Select one answer only. Let's rule out one by one. First is choroideremia. Choroideremia is a genetic condition leading to progressive retinal degeneration disorder and cause night blindness. It does not cause an iris defect or leukocoria. It typically affects males due to its X-linked inheritance. Next option is congenital toxoplasmosis. It may cause retinal scars and leukocoria but does not cause an iris defect. Torch screen was negative, ruling out this infection. Next option is retinoblastoma. Retinoblastoma is the most important differential diagnosis for leukocoria, but it does not cause an iris defect. Retinoblastoma typically present with intraocular masses and calcification, which are absent in this case. Next option is tuberous sclerosis. It can cause retinal astrocytic hematomas, which are white lesion in the retina, but does not cause iris abnormalities. Additionally, no other features of tuberous sclerosis, such as seizures or skin lesions, were present. So the most likely diagnosis is coloboma. The abnormal shape of pupil is consistent with an iris coloboma, that is a congenital defect caused by incomplete closure of the embryonic fissure during development, and the leukocoria, which is white reflex, is explained by associated chorioretinal coloboma, which is a defect in the retina and choroid. And there is no systemic abnormalities were identified which support the diagnosis of isolated ocular coloboma. Here is the second question. Which of the following procedures in the next most important? Select one answer only. Let's rule out one by one. Number one option is MRI scan of the head. MRI scan is useful when we suspect systemic conditions or abnormalities in the brain, such as those associated with syndromic coloboma, for example in CHARGE syndrome. However, in this case, there are no other systemic features. Next option is repeat renal ultrasound. A renal ultrasound is important in condition like aniridia, which is associated with high risk of Wilms tumor. However, coloboma and aniridia are different conditions. There is no evidence or suspicion of the kidney involvement in this child. Next option is visual evoked potential. Visual evoked potential, it measures how well the visual pathway from the eye to the brain are functioning. While this test can provide information about vision, it does not help in diagnosing or managing refractive errors, which are primary concern in this case. Next option is Wood lamp examination. A Wood lamp is used to detect conditions like corneal abrasion, infections, or systemic conditions such as tuberous sclerosis, which cause hypopigmented spots visible under UV light. This test is irrelevant in a child with isolated coloboma and no signs of systemic disease or hypopigmentation. Therefore, refraction for spectacle prescription is the most important next step. Refraction is the test to check for any refractive errors such as nearsightedness, farsightedness, or astigmatism. If left untreated, these refractive errors can lead to amblyopia, lazy eye, or strabismus. Early detection and correction with glasses are crucial to ensure proper visual development in young children. This is all about from this case. Thank you so much for watching. If you have any question regarding this case, comment below, like, subscribe, and share.